All right, let's dive into something I think we all think about a lot. This idea of the medical industrial complex, or like everyone calls it, the MIC. It's a system we all got to deal with, right? But it can feel very confusing sometimes.
Mm.
And you all have sent us a bunch of really interesting stuff to help us figure it out. YouTube videos, academic papers, even some data analysis. So the big question is the American healthcare system really about helping people, or is something else going on?
Yeah.
One of the most, I don't know, like strong voices we heard was this Dr. Cheryl Kunis in her YouTube video. It really grabbed my attention. She's like totally against privatizing Medicare. And she's really worried about these direct contracting entities, DCEs. You've probably heard of them. But get this. Now they're calling them REACH, which like stands for Realizing Equity Access in Community Health.
Oh, wow.
Sounds good, right? But Dr. Kunis thinks it's just a way to hide some maybe really big problems.
It's fascinating how she connects this to like the whole history of health insurance. She even talks about this guy, Otto von Bismarck, who started the first healthcare system.
Bismarck. Like way back.
Yeah, in the 1800s in Germany.
Wow. But what's that got to do with us?
Well, Bismarck wasn't just being nice. He thought to have a strong country, you need healthy workers. So healthcare was about like national power, not just helping sick people, you know?
So it's always been about more than just taking care of people.
Yeah. And in the U.S., Dr. Kunis thinks that's turned into a system where profit comes first a lot of the time. She talks about upcoding, which you probably know about. It's a billing thing. But she thinks it's a really big problem with Medicare Advantage and these DCEs because they can use it to, like, make more money, maybe even when they shouldn't.
And she's got some pretty powerful stories to back that up, right? Like those teachers in New York City, they were fighting hard against being put on Medicare Advantage.
Right.
Those are real people, really worried about losing good health care.
Which brings us to, like, the whole medical industrial complex thing. One of the articles you sent describes it as this huge web of, like, doctors, drug companies, insurance companies, all mixed up with the government.
Right. It's complicated. So many different parts, all with their own agendas.
And the stuff about healing justice, especially what Kara Page and Rita Valenti say, they argue the MIC isn't just, like, a neutral system, you know? They see it as part of bigger systems of oppression, tied to things like colonization, controlling who has kids, and discriminating against people with disabilities.
Whoa, that's a pretty intense statement. Can you break that down a bit?
Sure, they're saying the MIC gets to decide what's healthy and what's sick, and those definitions aren't always, like, based on science. They can be influenced by biases and who has power, which can lead to pushing aside or even punishing people who don't fit in.
So it's not just about treating illness, it's about who gets to decide what even is an illness.
Exactly, and that power has a huge impact on people and whole communities. It affects who gets care, what research gets funded, even how we see ourselves and our own bodies.
That's a really different way to look at it. And speaking of power, some of the data you sent shows the money side of the MIC. We're talking billions in profit for companies like United Healthcare, and it makes you think, are those profits coming from, like, denying people care?
It's a huge question. Profit isn't always bad, but the sources do raise concerns about how chasing profits can mess up priorities.
Yeah, and it's not just insurance companies. We read about how drug companies use this thing called patent thickets. When I first heard that, I thought it was like a magic forest or something, protecting expensive drugs. Turns out it's just legal tricks to keep prices high.
Right. Yeah, it's all about using the law to make their patents last longer and block cheaper generic drugs. And the sources have examples like Lipitor, Nexium, Seroquel. They all got way cheaper once the patent ran out.
Wow, it's crazy how much cheaper they got when other companies could make them. It really shows how much the market controls healthcare costs. But until those patents run out, people are stuck paying a ton for medicine they really need.
Exactly, and the sources point out that this has effects everywhere. We see it in people going bankrupt from medical bills and stories of people putting off treatment because they just can't afford it.
It's a reminder that healthcare costs don't just affect individuals, they affect everyone. This is honestly a lot. Is there any hope for a different way of doing things? The sources mention something called healing justice. What's that about?
Healing justice, like in Kara Page's work, it's a whole different way to think about healthcare. It's not just about treating symptoms, it's about getting to the root of why some people are healthier than others and challenging the power dynamics we've been talking about.
So instead of just fixing the problems the system creates, it's about trying to change the system itself.
Exactly. It's about communities taking care of themselves, using traditional knowledge, and not seeing people as abnormal just because the MIC says so. It's about giving communities control over their own well-being.
That sounds amazing, but can it really work with the MIC being so powerful?
That's the big question. The sources know there's no easy fix. But they talk about inspiring examples like the Healing Histories Project and the Health Justice Commons. They're trying to build a fairer healthcare system from the ground up.
So we've got this system that's all about profit-driven healthcare and a movement that wants a more holistic, justice-centered approach.
Yeah, that tension is at the heart of what we're looking at today. And we'll keep exploring it as we see how things like hospital mergers affect doctors like Dr. Berman and look into alternatives to the current U.S. system. But for now, let's take a second to think about what we've learned.
Yeah, it's a lot to process. What are your first impressions from this first part of our exploration?
I think what's really striking is how healthcare is rarely just about health. It's tied to history, power, money, and social control. Understanding all of that is crucial for navigating the MIC and fighting for a system that really prioritizes well-being for everyone.
Thinking about healing justice and challenging this whole MIC thing, like, are there people inside the system trying to change things?
That's a good question. And actually, one of your sources, this Dr. Nickel Berman, he has some interesting thoughts on that. He's a doctor who's been pretty vocal about the pressures doctors face in the system.
Right, he talked about how hospitals are buying up private practices, which, like, at first might not seem that bad, but he says it can lead to problems.
Yeah, exactly. Dr. Berman thinks this consolidation can drive up prices for patients, and it might limit their choices, like finding a doctor they trust. Plus, it puts more power in the hands of these big hospital systems.
And it's not just patients that are affected. Dr. Burren talked about how this affects doctors too, putting them in a tough spot.
Mm.
He even shared this story about being pressured to refer patients within the hospital network, even when he knew there were better options outside of it. Makes you wonder how often that happens.
It really highlights how the focus on money can sometimes go against what's best for the patient. And it makes you question, like, how much freedom do doctors really have to make decisions when they're part of these huge systems?
It seems like this whole consolidation thing just feeds the problems we've been talking about with the MIC, putting profits before patient care.
Yeah, it definitely adds another layer of complexity. It shows we need more transparency and accountability in the system.
So if we feel stuck, what can we actually do about it? Is there a way to push for a healthcare system that's more, I don't know, ethical and fair?
Well, remember what Dr. Kunis said. She really urged us to get involved, call our representatives, spread the word, even protest.
Like, we can't just sit back and take whatever care the system decides to give us. We have a voice and we need to use it.
Exactly. And that's a core idea in healing justice, too. It's about recognizing that we're all responsible for taking care of each other and for fighting for a system that reflects our values.
It's about making change happen, both individually and together.
And that might mean supporting initiatives like we talked about before, the Healing Histories Project and the Health Justice Commons, or finding ways to support community-based care that's outside the traditional MIC structure.
It also means having these conversations, right? Like what we're doing right now.
Hmm.
The more we understand, the better we can challenge things and demand change.
Yeah, for sure. Awareness is definitely the first step. Knowledge is power, as they say. And when we share what we know, it creates this ripple effect that can really lead to meaningful change.
Speaking of knowledge, one thing that really surprised me was this idea that the U.S. is kind of unique in how it does healthcare. Like, it's the only developed country without universal healthcare.
That's true. Most other developed countries have figured out a way to cover everyone without bankrupting them.
Which makes you wonder, what can we learn from other countries?
That's a really important question to ask. There's a lot we can learn from how other healthcare systems work, both the good and the bad.
Like in this Washington Post video with T.R. Reid, he said, the U.S. pays twice as much as other countries for healthcare. And those countries cover everybody, and people are healthier overall. It's crazy.
It does make you think, are there better ways to do this?
And the source talked about all these different models, single payer, socialized medicine, hybrid systems. It's a bit overwhelming, to be honest.
It's definitely a lot to take in, and it's important to remember there's no perfect solution that works everywhere. What works in one country might not work somewhere else because of cultural differences, economic realities, and political systems.
But that doesn't mean we can't learn from what they've done, right?
Of course not. We can look at the evidence, weigh the pros and cons of different models, and really think about what kind of system we want to build for ourselves.
One thing that stood out to me was this idea of rationing care, which sounds kind of scary at first. But the expert explained that in some countries, it just means prioritizing care based on medical need, not on whether you can afford it.
Right. It's about using resources wisely and making sure everyone gets the essential care they need.
It's kind of like triage, right? Making sure the most urgent cases get treated first.
Exactly. It's not about denying care. It's about making sure resources are used fairly and effectively.
This above the noise YouTube video we got, it argued that there are some downsides to universal health care, though, like maybe higher taxes and less choice.
Those are definitely valid concerns, and we need to be honest about the trade-offs involved.
So it's not a simple question with a simple answer. It's about weighing the benefits, like more people having access to care, less financial stress, maybe even better health outcomes overall, and weighing those against the potential downsides.
And ultimately, it's about finding solutions that work for us, considering our culture, economy, and what our politicians are willing to do.
The video also said that changing to a universal system could hurt innovation in medical research.
That's a common worry, but it's worth noting that many countries with universal health care have made big contributions to medical advancements. There are ways to design a system that encourages innovation while still making sure everyone has access to care.
It seems like this is always framed as an either thing, like either we have a profit-driven system or a government-run system. Is there any middle ground?
That's a great question, and it goes back to the idea that there's no one perfect system.
So it's less about finding the right answer and more about having an honest conversation about what kind of system we want as a society.
Exactly, and that conversation needs to include everyone, patients, doctors, policymakers, researchers. We need to move past the arguments and work together to build a system that really works for people.
Maybe part of that is looking at what other countries are doing and seeing what we can learn from them.
Absolutely. Like we've seen in this deep dive, the more we know, the better we can fight for a fairer and more equitable healthcare system.
Well, we've covered a lot, from the history of health insurance to how the MIC works, the economics, the potential of healing justice. It's been quite a journey.
And remember, this is just the beginning of your exploration. There's so much more to learn and think about.
We encourage you to keep researching, keep asking questions, and stay engaged with this issue because the future of healthcare is in our hands. Wow, it's amazing how much we've learned about the medical-industrial complex already, like its history, how it affects patients and doctors, even these alternative ideas like healing justice.
Yeah, and there's still more to think about. We've just scratched the surface here.
One thing I keep thinking about is, if we know the MIC has problems, where do we even start fixing them? It's just so huge.
It's definitely a big challenge, but I think step one is remembering we're not helpless. Like we talked about, individuals can make a difference by speaking up, educating others, and supporting things that match their values.
Right, like Dr. Kunis saying, we got to get involved in healthcare policy. But those big systemic things we talked about, like profit influencing medical decisions or hospitals getting too much power, those seem way harder to change.
They are, but not impossible. One of the articles pointed out how government regulations can shape the whole healthcare system. Like, think about the Affordable Care Act. It's got problems, sure, but it shows that policy changes can shift things in the MIC, get more people access to care, and protect patients from some of the worst stuff.
So even within the system, there's room to make it better.
For sure, there are always debates happening about drug prices, surprise medical bills, the role of insurance companies, all that. And those debates are shaping the future of healthcare in America.
Sounds like we got to stay informed and involved. But besides changing policies, are there other ways to make healthcare more fair and just?
One idea that's getting popular is value-based care. So instead of paying doctors for just doing more stuff, it focuses on how well they care for patients and the results. It encourages keeping people healthy and avoiding unnecessary procedures.
That makes sense, shifting the focus from profits to actually helping people.
Exactly, and some healthcare systems are trying it out already, getting good results. It's early, but it could be a move away from that fee-for-service model that's so big in the MIC.
You know, the more we talk about this, I realize it's not about just blowing up the system and starting over. It's about finding ways to change it from the inside, pushing for improvements that get us closer to healthcare that puts people first.
That's a great point. Big changes often happen slowly. It's a mix of policy changes, new ways of caring for people, and people's attitudes changing.
And we can all help change those attitudes by talking about these things, questioning how things are done, standing up for ourselves and our communities. We can help create a healthcare system that's fairer, more equal, and actually meets everyone's needs.
Couldn't agree more. And remember, this deep dive is just the start. We've given you some knowledge, but it's up to you to keep learning, keep asking questions, and get involved.
Thanks for joining us on this deep dive into the medical industrial complex. It's been a really interesting journey, and we hope it's made you want to learn more and get involved in shaping the future of healthcare. Until next time, keep asking questions, keep searching for answers, and keep diving deep.